Mononucleosis, mono, symptoms, treatment and diagnosis. Mononucleosis is an illness that commonly affects teenagers and young adults, but can affect children as well. Viruses, most commonly Epstein-Barr virus, EBV, and certain infections cause the illness. Mono is sometimes called the kissing disease because it spreads easily through bodily fluids like saliva. For most people, mono isn't serious, and it improves without treatment. Still, extreme fatigue, body aches and other symptoms can interfere with school, work and daily life. The Epstein-Barr virus, EBV, that causes mono is extremely common. Not everyone who has the virus develops mono symptoms, some people only carry the virus. There are often two peaks when people acquire EBV, early school-aged children and again around adolescence/young adulthood. Young children are often asymptomatic, whereas teenagers and people in their 20s are most likely to get mono. About 1 in 4 people in this age group who get EBV come down with mono, but anyone can get it, no matter their age. However, EBV is more likely to spread through other means like sharing drinks or kissing. Is mononucleosis, mono, contagious? Viruses that cause mono are very contagious. You can pick them up through contact with an infected person's bodily fluids, including saliva. The Epstein-Barr virus stays in your body in an inactive form even after mono symptoms go away. But most people develop mono only once. If EBV reactivates, it rarely causes symptoms. And people with weakened immune systems may develop mono symptoms more than once. Blood tests detect antibodies that your body makes to fight the Epstein-Barr virus. Management and treatment. How is mononucleosis, mono, managed or treated? Antibiotics to fight bacterial infection and antiviral medications to kill other viruses don't work against mono. Instead, treatments focus on helping you feel better by relieving symptoms. Sleep helps your body fight infection. Pain relievers, non-steroidal anti-inflammatory drugs, NSAIDs, ease fever, inflammation, headaches and muscle aches. Non-steroidal anti-inflammatory drugs, NSAIDs, ease fever, inflammation, headaches and muscle aches. Avoiding sports, physical activity can put too much pressure on an enlarged spleen, increasing the risk of rupture. Mono symptoms tend to gradually improve in about 4 weeks. An enlarged spleen that ruptures, bursts, is the biggest concern with mono in previously healthy individuals. Your healthcare provider may tell you to avoid strenuous exercise, contact sports and heavy lifting until you feel better. The best way to prevent getting the viruses that cause mono is by practicing good hygiene. Don't share foods, drinks or bodily fluids with someone who has mono or any signs of viral illness, like fever, cough, sore throat or fatigue. Expectant moms who develop mono from EBV typically have healthy pregnancies. While there's a slight chance you may pass the Epstein-Barr virus to your baby during pregnancy or after childbirth while breastfeeding, most babies don't develop mono symptoms. If mono is caused by a CMV infection during pregnancy, there is a chance your infant may be affected and you should discuss this with your obstetrician. You should also avoid strenuous activities to prevent a ruptured spleen.